I advocated for my patient one time and potentially saved their life. So backstory on this patient. I was doing shift change and getting a report from the night shift nurse, and the night shift nurse mentioned that this patient list had like this really different odor. They had like given the patient a complete bath, changed their sheets and everything, but like there was still this odor on this patient. We walked in together to like do the assessment, go over the rest of the report, and I definitely noticed that same smell. This patient had not really been able to take great care of themselves over an extended period of time, so we kind of just chalked it up to like this patient just needed maybe like a better bath. So I spent the first part of my shift like getting this patient clean, new sheets, new gown, like head to toe clean. We did hair, we did everything. And the odor did get better. Like it did get better to where I was like, okay, that is probably it. Also important to mention that this patient was on their menstrual cycle. Later in my shift, the patient got up out of bed, and like we know as women, when you stand up out of bed and you are on your period, a lot of times you have some extra blood. So that happened to this patient. When they stood up, there was some extra menstrual blood, and I noticed that the smells seemed to be coming from the menstrual blood. And so then I got to thinking, like, maybe this patient put a tampon in or something and just forgot about it, and it's been in for a little bit. And I didn't want to make her feel bad at all, but I did feel like I needed to talk to her about it because like I was a little bit concerned. And so I said, hey, like when you get your period, is this the normal odor of your menstrual blood? And she was like, no, this is not. And so I was like, okay, do you ever wear tampons or ever like insert anything internally for your periods? And she was like, yeah, I do wear tampons. So I was like, do you have a tampon in right now? And she's like, no, I don't think so. And I was like, okay, do you think you may have put one in like at a earlier time or previous cycle? Like, is there a possibility that there could be one in and it was left in? And she was like, yeah, possibly. So I took that information to our ICU doctor, and thankfully the ICU doctor was very receptive and was like, okay, well, let's get like a GYN consult and have them do a pelvic exam. And so that's what we did. We got a GYN consult, they did a pelvic exam, and sure enough, there was a tampon that had been left in for a while. And thankfully, like, we caught it. It got removed, and potentially like that could have been very, very bad for this patient, because it could have caused, you know, TSS, infections, all that. So it just goes to show how it's really important to like, one, be observant, to trust your gut, trust your assessment, and like you can kindly talk to somebody and be respectful in how you ask them about like these sensitive topics. But it was definitely something that we needed to take care of, because if it got left in for a longer period of time, like who knows what would have happened.